Hi, welcome to this TP webinar. I am Michaela von Geijer, a dentist working here at TP headquarters in Malmö, Sweden. We think that knowledge and insight sharing is important, and we hope that you, after watching this video, feel inspired to work towards good oral health together with us. In this part of Pharmacist Guide, I will introduce you to the topic caring for implants. I will go through why and how to clean dental implants and share some tips and advice for keeping implants healthy. Implant treatment is a solution for many patients with missing teeth. Did you know that inflammation around implants is very common? Studies show that somewhere between 18 to 74% of all patients with implants will get problems with inflamed tissue around the implants. Symptoms might be bleeding, redness, swelling, or pain from the implant site. But why does inflammation occur, and is that really a problem? Inflammation, or peri-implant mucositis, is caused by bacterial plaque accumulation on the implant along the gum line. At this stage, the disease is mostly reversible if you start to clean thoroughly. But if the plaque is not removed, the inflammation will increase, and in time the bone around the implant will start to break down. The mucositis has developed into a condition called peri-implantitis. Without treatment, the bone loss and inflammation will continue, and the implant may eventually have to be removed. So, how can you minimize or prevent the risk for peri-implant diseases? Well, as you have probably already guessed, the answer is good daily oral hygiene. So let's start with toothbrushing. Perhaps you need a smaller brush head for better reach, or a brush with two level filaments for optimal cleaning. TP has a variety of models and sizes for facilitate brushing. Most of us need some help from a dental professional to improve the result of the toothbrushing. Clean all 5 surfaces of the tooth implant. Did you know that the toothbrushing, manual or electrical, is not enough? Why? Because you only reach 3 out of the 5 surfaces with a toothbrush. Cleaning between is even more important when you have implants. According to studies and best practice, interdental brushes are most efficient in removing dental plaque between the teeth and reducing bleeding gums. When gums become healthier and less swollen, you will need a bigger interdental brush. Therefore, to buy a mix pack for sizing is convenient and the best way to try out which size to use. There should be some resistance when inserting the brush, but never force it in between your teeth implant. If you are uncertain, ask your dentist or dental hygienist for advice on size and techniques. TP offers 9 color-coded sizes for interdental brushes to fit narrow and wider spaces. The wire is plastic coated on all our brushes, which makes it safe for use with implants. For better access when cleaning further back, bend the wire, or if you use one of the 4 smaller sizes, bend the neck. The cap can be used to extend the handle. The interdental brush should be used with water. After use, rinse under water and let dry. Let me show you some examples of different implant constructions and how efficiently an interdental brush will clean the surfaces in between. These brushes are also available with extra soft filaments to suit persons with dry mouth or sensitive and sore gums. Some people may prefer a long and flat handle. The angled brush head can make it easier to access the back teeth or to clean the teeth from the inside. Easy Pick, the modern toothpick, is a complementary product for use during the day for people with implants or spaces between the teeth. It is easy and efficient to use, for instance after a snack. Easy Pick comes in 2 different sizes. A handy pocket case is included in some packages. But for the proper cleaning in the evening, I would recommend an interdental brush. Another option might be our bridge and implant floss with a spongy part and stiff ends for cleaning in between. Depending on the design of the implant construction, different complementary products are needed. Denture Care has a unique angle neck which reaches the implant surfaces from the inside. This makes it easier to clean along the gum line, the important surface where gums and implant meet. With this slim brush head with only 2 rows of bristles, you will easily reach the outside of the implant construction. The area where gums and implant meet is important to keep clean every day. The brush compact tuft has a small, firm and rounded tuft for precision cleaning along the gum line or around attachment and bars for overdentures. The last complementary brush I would like to show you is the Denture Care. This is the perfect brush for daily mechanical cleaning of a removable denture. The Denture Care has extra long and strong filaments to ensure good accessibility and efficient cleaning. The handle can be bent for improved grip and access. Did you know that plaque accumulation is by far the most important risk factor for implant diseases? Make sure to clean all surfaces thoroughly and choose complementary products depending on constructions and needs. Proper daily care of implants is vital for long-term success. If you suspect inflammation around an implant, contact your dental professional as soon as possible for a checkup. Thank you for listening to this part of Caring for Implants. For further information, please download the Pharmacist Guide. I invite you to continue browsing our other videos and materials on oral health, and to keep sharing.